Welcome to our e-poster Intrascrotal Mass in Rural Pediatric Urology Practice. My name is Emmanuel AbaraE. I present on behalf of my co-authors. We have no conflict of interest to declare. These are my disclosures. Scrotal and testicular pain in boys often raise concerns. When referred and assessed by the urologist, absence of any significant pathology is reassuring. When an abnormality is noted, several tests may be done, and that may require the child leaving his rural community to a big center for further care. Telemedicine, bringing healthcare professionals closer to their patients, can be a game changer here. With this case, we wanted to present a rare condition in a child in a rural community, examine the challenges of healthcare professionals face in making and communicating a rare diagnosis. This is our case. An 11-year-old boy, grade 6, referred because of intermittent scrotal pain in 2017. No abnormal findings were noted, both on physical examination and ultrasound. He was therefore discharged. 3 years later, he was referred with a cystic swelling in the left hemiscrotum, no redness, no skin changes, and no systemic symptoms. Ultrasound reported that right and left testes were normal, and we find that there were these findings in ultrasound of a mass that grew from 7 millimeter to 10 millimeter within 5 months. The differential diagnosis included lipoma, appendix testis, extratesticular rhabdomyosarcoma, lipoblastoma. This is the operating findings, and the pathology confirmed an unremarkable mesothelial lining, peripheral boundary of mature adipose tissue, and a central core of cartilaginous nodule. This created a differential diagnosis to include teratoma, but it didn't have all the characteristics of teratoma, chondrolipoma with a cartilaginous metaplasia, and the pathologist recommended diligent post-surgical follow-up. Over the period of 5 years, the child has been followed both by physical examination in person, scrotal ultrasound, and assessment by virtual care, telemedicine. And 5 years post-operatively, the testicle was normal, no evidence of recurrence. The take-home message here is that a case like this requires collaborative efforts of all healthcare professionals. We do not have a clear-cut diagnosis, and this condition remains very uncommon, with very few or no cases reported in the literature. Telemedicine as an option was very useful for managing this case in his rural community. Thank you. These are our references. Thank you for listening.